Greetings. As a prelude to the multimedia summary of the journal's April 2017 issue, I wish to introduce myself. I am Karl Nath, the new Editor-in-Chief of Mayo Clinic Proceedings. I was born and raised in Trinidad, West Indies. I received my medical degree from the University of Edinburgh, Scotland in 1976, and I did my internal medicine residency and nephrology training at the University of Minnesota. Since 1996, I have been on faculty at Mayo Clinic as a member of the Division of Nephrology and Hypertension in the Department of Medicine. I am delighted to welcome you to the multimedia summary of the journal's April 2017 issue. This month there are 4 articles designated as Editor's Choice or Highlights selections. Our Editor's Choice this month is an original article authored by Dr. Manaman and colleagues from Mayo Clinic in Rochester, Minnesota and Johns Hopkins University in Baltimore, Maryland. The authors examine the relationship between the use of skilled nursing facilities and hospitalizations in heart failure patients. Using the Rochester Epidemiology Project database, the authors found that approximately 40% of the 1,498 heart failure patients in the study were admitted to a skilled nursing facility. Among those with a skilled nursing facility admission, 37% had 2 or more admissions. After adjustment for age, sex, ejection fraction, and comorbidities, skilled nursing facility use was associated with a 50% increased risk of hospitalization compared with no skilled nursing facility use. Among users of skilled nursing facilities, arrhythmia, asthma, chronic kidney disease, and the number of activities of daily living requiring assistance were independently associated with an increased risk of hospitalization. These findings thus underscore the effect of physical functioning on hospitalization in heart failure patients in skilled nursing facilities and the need for strategies that will improve physical functioning. Our first highlight article in the April 2017 issue of the Proceedings is a review article authored by Dr. Supervia and colleagues from the Cardiovascular Rehabilitation Program at Mayo Clinic in Rochester, Minnesota. The authors identified evidence-based barriers to the use of cardiac rehabilitation services. Such services are generally underutilized, especially by women. The authors delineated demographic, socioeconomic, medical, and societal challenges faced by women and recommend using systematic approaches to help overcome these barriers. They also underscore the need for further research on the impact of novel cardiac rehabilitation delivery models, such as home-based cardiac rehabilitation. The second highlight article is an original article authored by Dr. Alter and colleagues from the University Health Network Cardiovascular Prevention and Rehabilitation Program, Toronto Rehabilitation Institute, University Health Network, and the Institute for Clinical Evaluative Sciences at the University of Toronto in Toronto, Canada. The authors examined the relationship between cardiac rehabilitation participation and health service expenditures in a universal healthcare system. Patients with higher levels of participation in cardiac rehabilitation utilize fewer healthcare resources and experience lower mortality than those with lower levels of participation. Healthcare utilization expenditures and mortality were highest in patients referred to cardiac rehabilitation, but who did not join in any on-site cardiac rehabilitation program. The third highlight is the next installment in the Symposium on Neoplastic Hematology and Medical Oncology, authored by Dr. Hafdonison, Hogan, and Madsen from the Divisions of Medical Oncology, Hematology, and the Department of Emergency Medicine at Mayo Clinic in Rochester, Minnesota. The authors reviewed the current state of the diagnosis and initial management of hematologic and oncologic emergencies. The authors emphasize three essential considerations. First, cancer patients commonly present to the emergency room or outpatient offices with complications of either the malignancy itself or the therapy they are receiving for the underlying malignancy. Second, a sound knowledge of the oncological and hematological emergencies is thus important for all healthcare professionals involved in direct patient care. Third, prompt evaluation and accurate diagnosis, followed by the institution of appropriate therapy, can be life-saving and prevent irreversible organ damage. You can access these highlights and the editor's choice articles free of charge during the entire month of April. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org and review other free content there. You can access the social media buttons near the top of our homepage to follow us on Facebook, Twitter, and YouTube, where you can review online first publications introduced on our website between the monthly issue updates. Our website also lists many news stories based on articles published in Mayo Clinic Proceedings. On YouTube, you can find video content such as full author interviews and our 60-second video article summaries. On our homepage, you can access our Mayo Clinic Proceedings fireside chats, which are available through iTunes in addition to our website. As always, we thank you for your interest in and your support of Mayo Clinic Proceedings.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.